And it is 10:30, and good morning and welcome to our MRTA chat, our educational series. Today we're talking about dental and vision coverage options. My name is John Green with Association Member Benefits Advisors. As we've got some folks that are still signing in here, I understand Nancy said there were a few snowflakes falling across the state, and I hope you're all staying warm and safe and enjoying the winter up there. But just a couple of quick housekeeping notes before I turn it over to Nancy for a moment. As a reminder, all participants are in a listen only mode. And what that means is if you want to ask a question, you have a comment, feel free to drop it in the chat or in the Q&A. We'll pause along the way. If it's something that pertains particularly to MRTA business, I may let Nancy answer that. If it's on the topic that I'm discussing, we'll stop periodically and answer those questions. There will be an opportunity at the end. Like I mentioned, we'll stop recording and open up the conversation. That way, if you want to hold up your hand, I can unmute you and you can speak out loud if you don't want to put it into Q&A out that way as well. We do record these webinars. I had an individual that emailed me this morning, says, hey, I missed out on this. I can't make it. And we record these. We put these out on the MRTA website under the benefits page. You can look at all the recordings. You can register out there for future webinars, things like that as well. So we're glad you're here. Thank you for joining us today. And we've got a lot to cover. It's not a huge in-depth conversation, but we do want to talk about some specific things out there and really just kind of hone in on a couple of benefits that you have available to you that are most popular. But right now, we're joined by your president, Nancy Craig. Good morning, Nancy. Tell us what's going on at MRTA.
Good morning. Well, you've got your picture in front of you. Maria Walden is our new executive director, and she will be officially taking the reins on February 1. So the day after we get our 5% raise, she has retired from PSRS, Public School Retirement System, and is coming on board with us. Everybody is so excited about it. And hopefully, I know John said he hadn't gotten his watchdog report yet. I got mine on Monday, and I live outside of St. Louis, so everything has to funnel into St. Louis. Last year, I didn't get my report until March. It's a blessing this year. They've hired more people. And then in that watchdog report, there are raffle tickets. They support the grants that we give to active teachers all over the state. So send those in when you get them, and you'll be eligible for $50 drawing. So anyway, and I also wanted to mention that on February 8th, I want everybody to be aware of who their state senator and state representatives are. And I want you to contact them. You either phone them at their office in Jeff City, or you email them. Email them probably is the best way. Just introduce yourself. Tell them you are a retired teacher, retired administrator, retired custodian, whatever position you had in whatever school district you belong to. You tell them that you are very pro public education. You want them to support public education, to fund it, and to there's a lot of bills going through that will take money away from them, and you are against those bills that take money away from public education. Just a thought. So mark your calendar, February 8th. And then on March 8 and 9, the presidents of your units and my board of my executive board, my board with the vice presidents will meet in Columbia, Missouri, to have a president's summit. And it's all things about MRTA, everything you want to know about MRTA. It's going to be an interactive workshops. Should be really nice. Sarah's really excited about the place. And I know she's sending out invitations to be there. So if you have an invitation on your computer to join us in Columbia, I want you to send that in. It's a real short turnaround time. So hopefully you have that information. But I'm going to turn it back to John. He does a great job. I've been on a lot of these webinars with him. And there is one he gave a couple weeks ago, if you missed that one, there's he mentioned an in case of death or disaster folder. And you need to get on the website and see if you can find that. John, you want to tell them what the name of that webinar was so they can get that? Because I really, really thought that was good information.
Thank you, Nancy. Absolutely. Great report today. I appreciate you sharing all those things out there. Just a quick reminder, legislative days, we're going to be in person. They're now going to be virtual, as Nancy mentioned. Email, call, that type of stuff as well. Get your raffle tickets. They're in the Watchdog. Make sure you get that to support those active teachers that were where you are. They're there now where you were and be able to support them. But the webinar that Nancy's talking about is a health and financial wellness in the new year webinar that we did couple of weeks ago. And at the end of the conversation today, if you missed that, if you'll just simply drop me an email, I'll show you my email address. I will send you a direct recording of that, a link to that recording, as well as the links to what she was talking about, the in case of death folder, the conversations about a financial roadmap for just your own personal financial advocacy out there. So Nancy, thank you so much for what you do. I know Nancy's going to visit a few units around, that she hits the road in full in April. A lot of things going on. Congratulations to this group. I look forward to see what you do on Monday, the 31st with your COLA. I know that inflation's eating a lot of that up, but you've got it. There are a lot of teachers in a lot of states that are envying what you've got, but congratulations and for your hard work to secure that. So Nancy, thank you very much. She'll hang around. If you've got any questions, drop it into chat. I'm going to put her on mute, and then that way she can respond back to you in the text chat up there as well as we go through there. So real quickly, my name is John Green. I am the Associate Field Vice President with AMBA, and my responsibility is to help retired educators and active educators understand what their benefits are through their association. I live a little bit north of Houston with my wife, who is a second grade elementary school teacher in the same school that she grew up in, the same school that my three kids grew up in. We follow the Baylor Bears everywhere. We did loan my middle son up to Mizzou for his grad work back last year, and he's back in Houston with his wife and working. And so we appreciate the opportunity to be here. Most of my career, like I said, has been spent with active teachers and retired teachers, helping them understand their retirement systems. So let's go ahead and get kind of jumping in here and talk real quickly. And Nancy hit on all of these points. The importance of MRTA, and especially down the time this legislative time, is being that pension watchdog. And I love that your watchdog is your mascot, that Blitz is your mascot. They're there, MRTA, to not only watch you over your pension, preserve how you receive your benefits, but keep you connected to your local community, whether it's through virtual events like this, in-person events, the convention coming up, all that kind of stuff as well, and then bring in the extra benefits and discounts and stuff, the perks of being a member. And that's really what we're going to talk about today. We work with MRTA members all across the state, and they tell us they appreciate this new partnership with AMBA because it helps fill those gaps that weren't covered by their district benefits or from their state or from their spouse. And they're portable. We have many members that move outside of state, and they don't want to be tied to a network. They can take those things different places. They're not tied down to where they are. But the number one and two reason that most MRTA members tell us they're appreciative of their relationship with AMBA and MRTA is that you can extend these benefits to your parents if they're still alive. You can extend them to adult children or family members that may not be eligible for benefits that you have because they've aged out. We're going to talk about that a little bit today. We're going to specifically talk about the dental and vision plans. This is the most popular plan of MRTA members out there, several thousand members that we have on this plan. So we're going to kind of break that down and help you understand what your endorsed dental and vision plans look like, what the options are out there. And then we're going to do a quick comparison to a nationally recognized plan that many members have had in the past. So let's jump right in here. Feel free to grab a pen. You're going to see this QR code here on the bottom. You're going to see this QR code quite a bit through the conversation at the very end. If you are joining us on your laptop or on your desktop, you can take your smartphone, open up your camera feature, and simply hover over that QR code, and a little form will pop up and you can ask for more information. We'll take care of that. We'll show it again later, so don't have to worry about it. We're talking about the dental plan. This is for retirees and your families. It's MRTA endorsed. They've taken a look at it. They've really scrutinized it and make sure it fits what you need out there. It's through Emeritus. And Emeritus is the largest dental network in the nation, the largest provider of dental insurance in the nation for many, many schools, associations, and private businesses as well. The thing that sets Emeritus apart is that they have the freedom, or you have the freedom to choose whatever dentist you want to go to. So if you're in a major metropolitan area and there's network dentists, that's great. But if you're in rural Missouri or somewhere else in the country, you're not tied to a network. You can go to any dentist that you want. There's not any type of open enrollment period, meaning you can enroll whenever you want. You're eligible to receive your benefits the month following the month that you enroll. So if you enrolled this week or today, you could start receiving your benefits on the 1st. So there's not any open enrollment periods. There's not any waiting periods, anything like that. It has a rewards program because we want you to use your dental benefits. If you know, MRTA has always been big on the health of their members and making sure that you lead a long and healthy life. Studies have shown, health studies that show good dental hygiene, good oral hygiene can really maximize your lifespan and help you with your health issues. So this rewards program does that for you. And I'll show you that in a moment there. And as I mentioned before, by being an MRTA member, you can extend your coverage to your parents who may be, elderly parents that you may have still living. You can extend them to your adult children. And I'll show you a little bit how to do that. So what that means is, as you know, you've retired, you may have adult kids that don't have your dental benefits anymore, or they work in a position that does not offer dental or vision insurance. You can have them, because of your membership in MRTA, take advantage of these benefits as well. So it's really a nice pass-through that you've got available to you. No long-term contracts. You lock in your rates for a couple of years so that you've got peace of mind knowing what your rates are out there. So let's dive right in. Take a look at what your benefits are. You've got 2 different plans in Missouri. Some states don't have 2 plans, but in Missouri, you've got 2 plans. MRTA has endorsed a platinum and a gold plan. They give you in-network and out-of-network benefits. So it does not matter whether you go to a dentist one way or the other that's in-network or out-of-network. Under the platinum plan and the gold plan, you have a maximum amount per calendar year of coverage per person, $1,500 for platinum, $1,250 for gold. Type 1 services, your routine cleanings, x-rays, exams, what you normally do when you go to a dentist for a checkup, 100%. No deductibles, it's all covered 100%. You're perfect, good to go. Then you start to get into your type 2s, your type 3 benefits, depending upon whether it's a filling, some type of denture repair, general anesthesia, stuff like that, or the root canals. You can see the various schedules of reimbursement. They'll cover 80% on the platinum plan for fillings, 70% under the gold, 50% for root canals, 40% under the gold for root canals under platinum after a $75 deductible, maximum of $225 family deductible that's out there. So it's a real simple plan to understand. Most dentists understand the Emeritus programs, very easy to understand, very easy to administer. The thing that I like about it is there's no network out there. So it's really a neat way to take advantage of your benefits for you as well. Again, if you've got questions, feel free to drop them in the chat. We'll stop periodically and take a look at those. Let's talk about the dental rewards program. As I mentioned, you have a dental rewards program that is built into your MRTA endorsed dental benefits. You have to use your dental benefits to receive your rewards. And this is kind of a unique thing. We don't want you to delay any type of dental care because we know that delayed dental care can lead to root canals and the unfun stuff. Not something you want to do. So anytime you submit at least one dental claim a year and the total amount paid is under $500, you have the ability to carry over an additional $250 into next year's maximum benefit. So for instance, under the platinum plan, you go see a dentist, you carry forward $250 into the next year, you've got $1,750 next year to use. So you can save up if you know you've got some major work and some major repair out there. So gold a little bit different there. You got a lower threshold for maximum benefits. You can carry that forward. So let's take a look at how this works for you, okay? So say you go see your dentist this year. Routine cleaning, have a cavity filled, whatever it is, at $94. Anytime it's less than $500, you're going to take into next year an additional $250 reward benefit, so that in 2023, you've got $1,750 that you can use at the dentist for whatever you need to be. You can carry over a maximum of $1,000. So in the platinum plan, you could have $2,500 or $2,250 under the gold plan. So what we see is a lot of people will say they'll go to the dentist every year, they'll have their cleanings, and the dentist says, you know what, we probably need to watch on that crown back there. It may be time to repair that or replace that. You can take that crown replacement and say, okay, I'm going to save up my rewards for next year and have more money towards that. My mom had some dental work back in January, and or it was early December. Time flies pretty quickly. Early December, and it was about $3,000. So she had some rewards money built up that she could use towards the replacement of her crowns. So that's a neat situation. Very few plans offer this. MRTA's endorse this because they like this rewards program that can benefit you as well. All right. Some people say, I've already got dental coverage. I took it, kept it from my school district. If I've got it that way, my spouse has it. The really neat thing about Emeritus and about the MRTA endorsed benefit, you can double dip. And what I mean by double dip, you can have two coverages. So you can go to the dentist, the insurance coordinator at your dentist can file it through one plan and then file it through the Emeritus plan, and that can lower your overall cost. Really a big deal if you've got multiple procedures you have to do, or some heavy dental work, some expensive dental work, things like that. This is a great opportunity to take advantage of that benefit. Most companies don't offer that. Most companies only have some type of a plan that does not allow for coordination of benefits, does not allow for double dipping. This plan allows you to double dip. We don't care. We want you to take advantage of your MRTA endorsed benefits because it's so important that you maximize what coverage that you have available to you out there. Really a neat feature. Okay. Here are the current premium costs. And then I'm going to compare this to a plan that is out there that's pretty popular right now. Under the platinum plan, that's got a little bit more coverage for you, some greater rewards, greater reimbursement rates, things like that. Coverage percentages out there starts at $49 for member only up to a family. And then you see the gold plan out there. So you've got two options. Again, many states don't have this, but thanks to MRTA, you do have two options. Again, if you already have dental insurance and you say, but my adult son doesn't have it through his work, this is a great opportunity for him to get dental insurance because of your MRTA relationship. Okay, let's talk about a nationally recognized retiree program and look at their benefits. I'm not going to say their name. Their initials, though, are AARP. I'm not going to say who they are, but their initials are AARP. And so they have a plan that is pretty popular out there. I looked at it really closely, especially in Missouri. Their plan varies based on where you live. If you live in Kansas City or you live in St. Louis, a little bit more coverage out there because they use PPO networks where you have to go exclusively to those dentists out there. With the plan through MRTA through Emeritus, you can use it anywhere in Missouri, nationwide, pick your own dentist, or you can use a network, whichever you prefer out there. This other plan through this other retiree organization that I'm not going to name, but their initials are AARP, has a waiting period for certain procedures. Depending upon what you're going to have, you have to wait sometimes 6 months or a year to get full coverage for that. No waiting periods with the MRTA plan out there. There's a deductible on the national plan out there through AARP for routine cleanings even. There's no deductible for routine cleanings with the Emeritus plan for MRTA members, although there is a small deductible for the other procedures as well. It's a lower maximum benefit for certain plans on the AARP plan. You've got a higher maximum benefit on your gold or platinum plans as well through MRTA. And this is a biggie. It's not available to adult children under the age of 50, where the MRTA plan does allow that. You can get adult children of any age and write a plan for them. There's no rewards program over there. There is a rewards program on our side as well. So there's a big option there. Plus, depending upon where you live, your plan could be about 25% more in the other plan out there. So I highly, highly, highly encourage you, take a look at our plan. if you have a dental insurance need, if you have a need for family members that need coverage, especially if they need coverage quick, take advantage of what MRTA offers for you and endorses through Emeritus. Okay. Any questions on dental? Feel free to drop it into chat. Again, at the end of the conversation, we'll go ahead and we'll talk about, we'll stop the recording and we'll just recognize anybody and you can speak and ask your question at that point. So let's go ahead and jump into the vision benefits and talk about the vision plan. We talk about these together because most often people buy them together. They take advantage of both plans, but this is a vision plan through VSP, which again is the largest provider of vision care across the country. It is endorsed by MRTA. It is a pretty simple plan. Thousands of providers all across the country, rural areas, metropolitan areas, Walmarts, Costco's, Sam's Club, different vision centers, things like that, all across the country. Extremely good benefits with low copays. Oftentimes, there's not a copay on exams. There may just be a copay on certain frames or lenses, things like that. Your vision is covered. Your doctor visit for the eye doctor every 12 months, small $15 copay out there. You get prescription eyeglasses for $25 copay out there. Every 24 months, you get a frame allowance. Depending upon the type of frame you pick from what they've got, it could be up to $170 on frame allowance. You get 100% coverage on your lenses for certain lenses, and then 25 to 50% savings or 20 to 50% savings on those extra coatings, scratch guards, UV protection, things like that on top of that. And then your contact lenses, if you're going to get those instead of eyeglasses, you get a free covered every 12 months. You get a 12-month supply of those, 100% covered out there as well. And then different savings within your provider as well. So there's a lot of different coverages out there that's available for you. They do have a network. Again, you're not required to go to the network. So again, that's the big difference between most plans. There is network and out-of-network coverage with no requirement to go to in-network either way. If you choose to go to a VSP provider, you see what all is covered in full there, even after your copay, your exams and your materials. Again, there's no copay for contact lenses. Then you see your allowances for your frames and things like that. If you go to an out-of-network vision provider, and that's totally fine as well, you have certain allowances up to, you see those dollar amounts out there as well. So you've got good coverage in network, good coverage out of network, the best of both worlds, depending upon where you live. You can go to someone that you've been going to forever, and they'll take care of that. So let's see if there's any questions out here, and we can talk about that. All right, Maureen asks, is there a limit as to how many adult children are covered under one of the plans? Okay, that's a good question, Maureen. Just to make sure, once, just from a general insurance perspective, regardless of whether this is with AMBA, MRTA, or whoever, once an adult child hits 26, they are no longer eligible for benefits under their parents' plans. That's anywhere in the country. At 26, that adult child needs to secure their own coverage. Now, if it's a husband and wife in a household, that can be under one plan. If it is 3 of your sons, each one of them would have to have a plan, because you're talking about a married household versus just adults, period. So if, like in my case, I've got 2 that are over 26, and so they would each have to have their own separate dental plan. Okay, I hope that answered your question that way. So if they're married in a household, of course, you can have 2 adults on a plan. If you are, if they're, single out there and all of their, you have multiple children over 26, they would have to have their own individual plan that way. Okay. See if we got any other questions that have popped up there. Okay. This is Joyce. She's asked, Joyce, you asked about having 4 dental cleanings in a year. Would they all be covered in a year? I had something similar. The dentist says because I had something deep gum line, whatever, I don't know. He had to file it and get it approved for 2 visits a year. So to say that the plan wouldn't approve it, usually the dentist has to file that for medically necessary, and so they will approve that, and that's usually covered under that plan. What they'll probably only cover though is x-rays once a year. They'll do those deep cleanings, those deep gum line cleanings, things like that. And if you've got certain dental work, they will provide it that way. So it's important that that dentist does a pre-treatment plan with the Emeritus, and they can get it approved. And it could be based on past history, procedures you've done, things like that. So that's not out of the question, but for me to say yes right off the bat, I know it's on a case-by-case basis for those multiple visits based on medical history. So good question, Joyce. Thank you very much. Keep those questions coming in, and we'll answer those questions there. Okay. All right. Jeannie, you ask, I've been going to the same dentist for many years. My plan in the past covered these visits. Am I still on that plan? That I can't tell you, Jeannie. I don't know what plan you're on. So if you purchased your plan through MRTA, through Emeritus, or if you were on an MRTA plan in the past that converted to Emeritus through AMBA, then yes, those benefits carried forward. Okay. I'm going to give you my email address here at the end, and you can email me and I'll get you the phone number for our dental and vision folks, and they can verify coverage for you and take care of you that way. So, but that's a really good question, because we do have some members that were on the old MRTA plan that converted over to the Emeritus plan. We did our best to keep all those benefits, all those dentists, all taken care of the same way. So you shouldn't have any gaps in that regard. So here are the vision plans. Again, you have out-of-network benefits. I showed you some of those things as far as your frames and your lenses and your exams, what your coverage amounts are. These are the rates for the vision plan. It's less than $12 a month, up to a family for about $26 a month out there for vision plan. If you get contacts, if you've got glasses and that type of stuff, it's important to have good vision coverage. And what we do with ours, we'll go to the Walmart optician, get our exam done that way. We'll get the prescription, order it through 1-800 contacts. They seem to be, they all coordinate, and we have no problem, no cost whatsoever at all. So really like those benefits that way. So, all right, if you got any questions, feel free to drop it into chat. We have a short conversation today because there's really not a whole lot of in-depth stuff to cover there. Feel free to drop it in there. Just a quick reminder, Nancy mentioned these webinars. We've got a big one coming up on the 10th. We're going to do the basics of Medicare. Kel and I are going to break down all the changes to Medicare this year. And for those of you who have yet to turn 65, we're going to talk about that process of what you need to do prior to turning 65 to get on your right Medicare plan. We're going to talk about supplements. We're going to break down the alphabet soup, talk about the donut hole, all that kind of mess with prescription drugs, and show you how Medicare has tremendous coverage for certain things and where some of those gaps could be that could really be a bugaboo for you, and what the government has done, probably over the past 10 years, that has greatly impacted, especially rural Missouri residents, in regards to certain coverages. And we're going to talk about that and hit that pretty hard on the 10th. On the 24th, we're going to talk about all the fun new travel benefits. Hopefully your snow's done, thaw, you're ready to start doing stuff, and get out there and enjoy those spring break times and all the fun stuff, the discounts that are that way, as well as the emergency transportation issue in Missouri. And then we're going to follow up in March with our long-term care conversations, some really good conversations. So make sure you jump on these calls. I know you know how to do that. Register for those things. Look out for the emails for that. Please, please, please. We talk about legislative season. We talk about that 5% COLA. That could not have been done without the 30,000 members of MRTA actively lobbying on your behalf for those things, those benefits. Let your fellow retired educators who are not members of MRTA know about these webinars. It's a great introduction to learning about MRTA. So please, please, please get out there and let people know about these webinar series and let them know about MRTA. All right, I'm going to open up for any questions. I'm going to stop recording here,